Now, on the 27th, which is on Sunday, which is less than 72 hours from now, we have the mother of all masterclasses, multiple pregnancy bootcamp. I know you've been wanting to have twins, triplets, quadruplets, and you've been wondering, do I have a chance to have a baby one time and I stop having babies? That's actually the real interpretation of multiple pregnancy. In 2022, you can have your two babies, you can have your three babies, you can have your four babies, then you stop having kids. Now, this is 2022, so we are not in a competition with anybody regarding the number of kids we are going to have. We are going to have the kids we can look after. So I know some families might want to have two, some might want to have three, some might want to have four. Guess what? You can have all of them in one sitting. How about having two girls, two boys, and that's the end of the discussion? Or two boys, one girl, or two girls, one boy, whichever way you want. God is able to do this. So what we're going to do on Sunday is to break it down to little pieces, which you can understand better. I have a subject matter specialist, someone that has really been in the system, someone that has helped a lot of women that had infertility all the way from Abuja. He's going to come. I'm going to be there. Dr. Chudi is going to be there. We're going to share our knowledge. We're going to share the recent knowledge, information about multiple pregnancy for everybody. So there are a couple of things you need to understand about multiple pregnancy. There are a couple of things you also need to understand about the risk factors. There are a couple of expectations. There are a couple of things that might make you not to be a candidate for multiple pregnancy. So it's not all women that can have multiple pregnancy, but any woman can have multiple pregnancy. When your multiple pregnancy happens spontaneously, then you have a better chance of having identical twins. Now, there are a couple of other things we're going to talk about. So some individuals might have an advantage from your maternal side. There are some locations, so a lot of things. But the point I'm making is the fact that you can have multiple pregnancy in 2022. This is March. An average pregnancy is 42 weeks, right? So which approximates to 9 months. So guess what? March is the third month. Every member that wants to become pregnant in 2022 should make extra effort to make sure that latest April, you're pregnant. Do you know why? Pregnancy takes 9 months. So if you're able to achieve pregnancy, let's say towards the ending of the month, which the month is already gone, or maybe first week in April. So what's going to happen? You're going to go for your urine test. You're going to go for your blood test. You're going to go for your ultrasound. So you have to do the three of them. Ultrasound is the clinical evidence that you're pregnant. So when you've gone for urine is going to check to tell you, hey, you're pregnant. That's like qualitative test. And you're going to rejoice and dance and tell a lot of people. It hasn't ended though. You step up to go for your blood test. When you go for your blood test, we are still looking for that so-called pregnancy hormone called beta HCG, beta human chorionic gonadotropin. That's the so-called pregnancy hormone. When we are checking your blood, we are looking at the quantity. When we are checking your urine, we are not looking at the quantity. So blood can be a qualitative and quantitative test. Now, the reason why we need to look at the quantity is because for a normal developing pregnancy, it's expected that that level of beta HCG will be doubling every 72 hours. Unfortunately, some women might have challenging pregnancies. The baby might not be viable. So you need to be careful. Every pregnant woman should be in her ANC. Let me tell you why. There are so many challenging pregnancies. There are so many women that will be pregnant, but the pregnancy will not have good outcome. So there are so many non-viable pregnancies. And I'm going to name a couple of them. You can have molar pregnancy. A molar pregnancy, for some reason, when the father was exchanging genes with the mother, something happened and there was a big error. So instead of the baby to have normal tissues forming, abnormal tissues formed. So molar pregnancy is an example of non-viable pregnancy. Now you can have a type of pregnancy we call chemical pregnancy. In chemical pregnancy, is like a big shock. You got pregnant. Then the time we're supposed to see the evidence that you're pregnant, then it happened that you might have had early miscarriage, early silent miscarriage. So suddenly your period will show up as if you're no longer pregnant. Now you can also have blighted ovum, or what we call anembryonic pregnancy. In this situation, the sac is empty. There is no evidence that you're pregnant. Now, you can also have ectopic pregnancy. In ectopic pregnancy, unfortunately, when fertilization happened in the tube, instead of the pregnancy to come back and implant in the womb, the pregnancy will stay back in the tube and start developing. That's called tubal pregnancy, a type of ectopic pregnancy. Pregnancy is not supposed to happen in the tube. When it happens in the tube, it can damage the tube, it can kill the woman, you can bleed to death. So these are types of non-viable pregnancy. Now, some women can have what we call missed abortion or missed miscarriage. So your pregnancy is no longer viable, but for some reasons, you didn't exhibit those classical signs of miscarriage. So you didn't bleed, you didn't have pain, but your baby is dead on the inside. So you need to be careful. The 9 months journey of pregnancy is not a journey you embark on yourself. We need to be careful. As a mother, the biggest friend you have right now, if you're pregnant, is your baby. The first doctor of the baby is the mother. You have to have an instinct. You have to have this feeling that maybe my baby is not feeling okay today. Maybe you used to know when your baby is kicking, or you used to feel your baby's movement and all that. Then suddenly you're no longer feeling your baby's movement. You should be worried. When that happens, you ring your doctor. Now, some babies can also have increased activity. So when babies are distressed, they can have increased activity or reduced activity. So we don't want your baby to be overtly moving excessively compared to how the baby used to move previously, or not moving at all. Unfortunately, some women might be carrying babies that have had what we call IUD, intrauterine death. You should not carry a baby that is no longer viable and you don't know. This is why you need to be careful. Whatever enters your mouth, and you go for all your ANC. Becoming pregnant is not the end of the journey. The end of the journey is delivery of the placenta. Once we have delivered the placenta, that pregnancy has ended. Be careful, okay? So every pregnant woman in our community, we're giving you an open check to allow us look after you in our lounge. ANC Lounge, SGHS ANC Lounge. You go there, you fellowship with other pregnant women. Now, you can have your own one-on-one ANC doctor in your location, which is highly advisable. But we want you to come so that we can fellowship together and see what we can do for you. Now, tomorrow, for these Fridays, if you can miss any clinic in our group, you don't want to miss Fridays because Fridays are special clinics. So tomorrow, what we're going to talk about tomorrow, the routes and the ways women around age 50 and up can become pregnant and become a mother. Our clinics on Fridays are predominantly meant for women from 35 years and above, but we placed it at that 40, okay? By default, as you're getting older, it's going to be a little bit difficult, so the older you get, the more it's going to be difficult for you to become pregnant, but it's not impossible. You can become pregnant until you go into menopause. Once you still have eggs, pregnancy can happen anytime. It can be natural means, it can be assisted means, but take all your chances. So there are so many of our members that are hovering around 48, 49, 50, and you're wondering if you can still become a mother. Guess what? You can. Do you know why? Because so many people are becoming mothers. We actually have the oldest mother in our group. Amazing lady we have to send back to Nigeria. She went there, had a procedure, came back to New York, had a baby. She's a mother of a beautiful baby. So I don't believe in impossibility. I believe in the possibility of the possible God. So join us tomorrow. Remember to join me on all the platforms. So I'm in TikTok. TikTok is like my new place I'm learning how to navigate through TikTok. Then catch up with me in YouTube, Tuesdays and Saturdays. Instagram by default, I'm there. Facebook, we have different platforms you can catch up with me on my Facebook. So if you're my personal friend in Facebook, you can follow me through my timeline. Then you can go to my group, the Health Hub, and you can go to our page. And we also have a new page, community page. So if you're in any of these portals, you can't get it wrong. Okay? So remember, if every other thing fails, continue to pray to God. God is the ultimate designer of everything. Then continue to pray. When you have prayed, go and make love every other day. When you've done all this, practice. Look for help through a professional. Okay, so I'm going to join Dr. Ndiche in a few minutes to just stay in the background to listen to the clinic. Then tomorrow I'll see you guys. Until I see you, God bless you and enjoy the rest of your Thursday. Bye-bye for now.